Welcome back. India Today has now accessed the blueprint for the vaccination drive for everyone above the age of 18 from May 1st. Here's how it's going to work. The registration for the vaccination on the CoWin portal will begin in 48 hours. So the portal will be open in another 48 hours for registration. The documents, the process, all of that remains the same as it has been for the last many months. More centers, more private facilities are currently being added to the list so that there are more venues that people can choose from to go ahead and get vaccinated. There have been a lot of questions about really what the government's plan is as they're opening up vaccinations for all from May 1st. There were questions about whether we're fully prepared infrastructure-wise for this step of vaccination. What we're hearing now is that more centers, more private facilities are being identified where vaccination processes will be kicked off. The documents that you will require to get vaccinated are pretty much the same as it's been for the last few months. On the CoWin portal is where the registration will be allowed, and for everyone who's eligible, basically if you're 18 plus, you are eligible for the vaccine come May 1st. So you can register yourself on the CoWin portal from the next 48 hours. So in 2 days from now, that portal is going to be opened up for registration. So this is the information that we're picking up on exactly how the government plans to go about the next phase of vaccination, which no doubt is the most challenging of the lot because of the kind of population that we have. There have been a lot of questions about whether we have the infrastructure in place. So the government is already working towards it. We understand that a lot more centers are going to be set up. Milind Sharma is joining us live with more details on this. Milind, just explain to us what is the government's game plan here? How do they plan on ensuring that the next phase of vaccination, the most crucial phase of vaccination, remains smooth?
Well, the government's already been working on upgrading the CoWin app platform. The latest information that we have is that all those above the age of 18 will be able to register on the platform in the next 48 hours. Now, the registration process remains the same. You have to log in first. Initially, if you were below the age of 45, you could not log in into the app. So you have to log into the platform, input your age, submit the same kind of documents, whether it's an Aadhaar card or a PAN card or a driving license or any other document. Once you have been registered, the government will then connect you with the private centers as well as government centers that will be giving the vaccines. But very importantly, right now, only the registrations will happen. If you need to book the date and the slot, for that, the hospitals, the private facilities will need to update their timetables. Only after they have updated their timetables will I or you be able to book an appointment, say on a particular date or for a particular time. And that will happen only after May 1st. So registrations in the next 48 hours, but the timetable and the selection of booking slot and time will be done on May 1st. And that is when you will get an appointment. The government is also appealing that it would be better if people don't rush to the centers without an appointment and take an appointment before going to any vaccination center to avoid overcrowding of any kind. It would be better if appointments are taken on the CoWin app to avoid any sort of rush on any of the private facilities. Another very important point shortly I'd like to tell you, private facilities or firms and companies who will be vaccinating their employees, if the number is very large, they will need to submit the data on the CoWin app so that the government keeps track of the number of people who are being vaccinated by the companies. So this is something that will need to be done because the government also needs to track adverse events following immunization.
All right, Milind, request you to stay on with me because I want to really get more details from you on what really the blueprint is all about. But before that, I want to play out a conversation that Milind had with Mr. RS Sharma. He is the National Health Authority CEO, the man behind the CoWin portal. He tells us exactly what the vaccine for all process is going to look like and when you can register for the vaccination.
May 1st is when India is going to begin ramping up of vaccination drive for the third phase, where all above the age of 18 will also be vaccinated. I'm joined by RS Sharma, who's the head of National Health Authority as well as in charge of CoWin operations for scaling up of vaccinations in the entire country. Sir, thank you so much for joining me on India Today. I would like to ask you, what are the preparations, sir, that CoWin and the government is now going to make to scale up vaccination for those above the age of 18 years?
Well, thank you, Milan, for having me on your channel. I think from 1st of May, the third phase of vaccination is going to begin in this country. And we are now enlarging the coverage to 18 years onwards, 18 years plus. And the necessary changes are being made in the CoWin platform to take care of those increased requirements, both in terms of, its broad logic, as also in terms of the infrastructure at the back end.
So what kind of changes are being made at this point? Will the registrations remain the same?
Yes, registration will remain the same. Earlier, the registrations of people who were less than 45 years of age were not accepted. Now the system will accept the registration of people with 18 years plus age, and that should start within the next 48 hours. That's one change which is going to happen. Second is that, as soon as the centers which are going to offer vaccinations of people to people more than 18 years and above, they will have to register on the CoWin portal and publish their schedule and timetable, because then and only then people who are registering on the platform will be able to make appointments with those centers.
So, sir, are we looking at addition of more centers now that all above 18 years will also be getting vaccinated? Will there be adding of more centers to the app?
You are aware of the latest policy of the government, central government, which basically mandates that 50% of the vaccines will continue to be purchased and procured by the central government and will continue to be distributed free of cost to people of 45 years plus, and the rest 50% of the supply will be sort of distributed among the states, among the sort of private hospitals, and also the corporate industrial houses, which will be able to cater to the requirements of 18 years plus, or whatever age they decide, at whatever prices they decide to offer their services. So that part is also being factored in. Only thing I must inform you that the CoWin does not concern itself with the pricing and payments, etc. So it's only ensuring that every vaccination which takes place in the country is appropriately recorded, and a record is kept so that at a larger level, and even for the policymakers at the state level and hospital level, etc., they are aware about the numbers and the statistics in terms of the gender, age, vaccine type, etc. So that's what is being planned.
Let me take this back across to Milind Sharma for all the details that you need to know on the next phase, the vaccine for all phase that will begin on May 1st. Milind, so far the vaccination process that's been underway, come May 1st, this will be the biggest challenge for the current process and the checks and balances that are in place, whether it works or not, because this is when you'll have maximum population coming out to get vaccinated. Three concerns that people keep voicing. Number one, whether the CoWin portal can handle that much of traffic. Number two, do we have enough infrastructure for this mass phase of vaccination? Number three, do we have enough vaccines?
Well, definitely, Akshita, these are the important questions that the government is providing answers to. But on May 1st, there will be a rush of people who will be wanting to vaccinate themselves, looking at the current situation and the way the pandemic is progressing in the country, which is why this decision was also taken by the government. And it is working on breakneck speed right now, at least if we talk about the CoWin platform, so that all the new vaccines that are available will also be available on May 1st. Now, the government has not been very clear on whether we'll have Sputnik V on May 1st itself, but certainly they have said the registrations will open after 48 hours. The vaccines will be available for those who wish to get themselves vaccinated. Private firms have also been, now been given the go ahead to procure vaccines directly from the pharmaceutical companies. So it's a complete open up into the market right now. And the government is very importantly advising that one must go after booking an appointment. One must try to register and go through the CoWin processes. And that would avoid overcrowding at centers and disappointment for a lot of people who reach the vaccination centers and then are told that they need to go back again. So that kind of confusion should be avoided. If you have an appointment, go ahead, select the center. The government has also said that we'll be able to select the vaccines and the center both, but they have nothing to do with the pricing now, Akshita, because the pricing has now been decided by the pharmaceutical companies. We know Serum Institute has increased their prices to 400 and 600 rupees. And this is a new process for the 18-year-olds and above. But very importantly, the drive for the 45 plus and 60 will also continue in government centers. So it will be done simultaneously in many ways. And we'll have to wait and see what actually unfolds on the 1st of May when we'll all be able to get the vaccine.
Just explain to us also, Milind, in another 48 hours, the CoWin portal will be open for registration. This perhaps is being done to ensure that last minute there's no rush. Everyone's trying to log on to the CoWin portal and it collapses. But having said that, what is the process that will be followed? If 2 days from now, I go ahead and log into the portal, what can I go ahead and register myself for? Will I get all the details of my vaccination on May 1st?
Well, so what we've been informed right now is that you'll be able to register in the next 48 hours. So maybe by 24th of April, we'll be able to register on the platform. One thing that's very important is that right now there'll only be registration happening, which means that you'll need to submit your documents, your age, your name, and other such details. The booking of the time and the slot and the center totally depends on whether or not the center publishes their data of the timetable. So for example, if I am based in Delhi and I want to get vaccinated at AIIMS or at RML or at any other private hospital such as Max, if Max updates their timetables and booking dates on 1st May, I can go select a time, say 1 p.m. in the afternoon, and then book the center at which I want to go, whether it's Max Saket or Max Patparganj, and then go ahead if I get a confirmation of the booking. But for now, registrations will happen. What the government means by registration is people can create an ID. So the ID will be created for me, for you right now in the next 48 hours. And then the timing and the booking of the slot will happen perhaps after May 1st, when the centers declare that we will be vaccinating from 9 a.m. to 9 p.m. or 24 hours or whatever their facility caters to.
All right, that was very informative. Milind, thank you for joining us with those details. The process has been laid out by the government. In another 2 days, the CoWin portal will be opened up so that people can come out, register themselves, set up their username, etc. on the CoWin portal for vaccination. But when you talk about the next phase of vaccination, which are the vaccines that India has and which are the vaccines perhaps we could be getting very soon? Let me just explain that for you about India's vaccine arsenal. We have Covishield, which is already under restricted use by Serum Institute of India, AstraZeneca, Oxford vaccine, Covaxin by Bharat Biotech, which is also being used currently in the country after having gotten emergency use authorization. Sputnik V is the latest vaccine to have gotten the nod from the authorities for authorization for restricted use. There's a lot of talk also about Zydus Cadila's Zycov-D vaccine. It's currently undergoing trials. It's in phase 3 of trials. Johnson & Johnson's single-dose vaccine is yet to seek a trial nod in India. If that happens, we'll have to see if the authorities give the go-ahead. There's also a lot of talk about India's messenger RNA technology, which is being used to create a vaccine. It's been given the nod for trials. So as far as emergency emergency use authorization goes, it could take some time. Nasal vaccine deemed a game changer of sorts. Trials are underway currently by Bharat Biotech for a nasal vaccine. And then you have serum's CoVovax, which is on phase 3 trials currently.